Hello, I'm Dr. Seema Reddy, dental surgeon at Akkineni Hospitals. I hope you're doing well. In today's session, I'll walk you through some important points. Do stay with us and note them down.
2.5 billion. I really want you to just let that number sink in for a second. Right now, literally as we speak, the World Health Organization estimates that nearly 2.5 billion people worldwide are walking around with untreated cavities in their permanent teeth. That is a staggering, almost incomprehensible global scale, isn't it? And, if we bring that scale a little closer to home and look at data from India, over 60% of adults currently have untreated dental cavities. That means if you look around a crowded room, more than half the adults standing there are harboring this condition. But here is the incredible paradox we're going to unpack today. Despite these massive numbers, this is actually one of the most preventable diseases in all of medicine. So welcome to this explainer. I am absolutely thrilled you're here. Today, we're going on a micro to macro rescue mission to really demystify dental caries, which is just the clinical term for tooth decay. We are going to break down the exact science of why our teeth decay, and way more importantly, how we can empower ourselves to stop it dead in its tracks. Okay, let's lay out our roadmap. 1. The global epidemic. 2. The battle in your mouth. 3. Demographic danger zones. 4. Stages and treatments. And finally, number 5, the prevention playbook. Starting off with Section 1, the global epidemic. We've seen the prevalence, now let's look at the opportunity. Moving right into Section 2, the battle in your mouth. It's essentially microscopic chemical warfare. So how does this chemical warfare actually go down? Let's walk through the mechanics of the attack step by step. Step 1, bacterial plaque, specifically culprits like Streptococcus mutans, colonizes your tooth surfaces, forming this biofilm. Step 2, you eat, and these bacteria metabolize the dietary sugars and fermentable carbs you've just consumed. It's an absolute feast for them. Step 3, as a byproduct of that feast, they produce organic acids, mostly lactic acid. Step 4, these acids lower the overall pH of your mouth. And finally, Step 5, this repeated acid exposure causes progressive demineralization of the tooth enamel. It literally starts breaking it down. Now, what's really interesting here is this exact number, 5.5. This is the critical threshold. When the pH in your mouth drops below 5.5, the microscopic attackers start winning the battle. At this specific acidity level, hydroxyapatite, which is the actual physical mineral that makes up your tooth, begins to dissolve. And understanding how we trigger that 5.5 threshold reveals the biggest aha moment of our entire explainer. Think about sipping a sweetened drink slowly over 3 hours versus consuming the exact same amount of sugar in, say, 10 minutes. See, tooth decay is driven by the frequency of sugar exposure, not just the sheer quantity. Sipping that drink over 3 hours keeps your oral pH continuously low. It never gets a chance to bounce back. That makes the slow sipping far, far more damaging to your teeth than just drinking the whole thing at once. All right, on to Section 3, demographic danger zones. Let's talk about who is actually most vulnerable here. It turns out it's a highly diverse group. Children with high sugar diets and poor hygiene, obvious targets. But adults with dry mouth, also known clinically as xerostomia, are in a huge danger zone too. Why? Because saliva is absolutely critical. It buffers those acids and helps remineralize your enamel. Without it, you basically lack your primary defense system. The same goes for frequent snackers, people with deep molar fissures where food just gets trapped, or adults with gum recession. Receding gums expose the root surface, called cementum, which is actually way more susceptible to decay than your tough outer enamel. Which brings us to Section 4, stages of decay and treatment. The chronological destruction. This timeline illustrates a pretty chilling progression if these attackers are left unchecked. It starts at stage 1 with a white spot lesion, just a painless, chalky spot of subsurface demineralization. If you ignore it, it breaks the surface in stage 2 as enamel caries. By stage 3, dentino caries hits the softer dentine beneath, accelerating really rapidly and causing sensitivity. Stage 4 is pulpal involvement, where the infection hits the nerve. This is where you get that severe spontaneous pain. And finally, stage 5, a periapical abscess. The infection spreads beyond the tooth root, causing swelling, fever, and serious medical risks like cellulitis. But hey, don't panic, because there is a solid defense for every single stage. Here is how expert dental teams, like those at Akkineni Hospitals, perfectly match each phase with a specific intervention. Stage 1 is met with remineralization therapy. Enamel and early dentinal caries, Those get a composite, tooth-colored filling. Larger dental caries might need a more durable ceramic inlay or onlay. Once you hit that pulpal involvement, you're looking at a root canal treatment to remove the infected tissue. And if the tooth is truly irreparable at the end of the line, extraction and replacement with an implant or a bridge. But I want to share the absolute most empowering fact of our whole explainer. White spot lesions are completely reversible. Seriously, if you catch this decay at stage 1, simply improving your hygiene and applying fluoride allows the tooth to literally heal itself. No dentist's drill required. How amazing is that? Let's move into Section 5, the Prevention Playbook, stopping that microdecay in its tracks. So how do we make sure we literally never get past stage 1? Here is your macro lifestyle checklist. Number 1, brush twice daily with fluoride toothpaste. It's hands down the single most evidence-supported preventative measure we have. Number 2, daily interdental cleaning, like flossing. Your toothbrush simply cannot reach between your teeth, and that's where decay loves to start. Number 3, limit sugar frequency to 3 or 4 exposures a day max, ideally just keeping it to meal times. Number 4, fissure sealants. Applying this protective plastic resin to the deep grooves of kids' molars prevents up to 80% of fissure cavities. Combine all that with professional fluoride varnishes and a routine checkup every 6 months to catch those white spots early. Now, I really want to call out this specific rule because it's a habit so many of us actually get completely wrong. Don't rinse with water immediately after brushing. I know, it sounds super counterintuitive, right? But if you rinse right away, you are literally washing all that protective fluoride straight down the drain. Just spit out the excess toothpaste, but let the fluoride remain on your teeth so it can actually do its job of remineralizing the enamel. Just a few bonus tools for your playbook here, especially if you fall into those demographic danger zones we talked about earlier. Xylitol is a sugar alcohol found in some chewing gums that actually inhibits the growth of those acid-producing bacteria. It's fantastic. And if you suffer from dry mouth, utilize sugar-free gum, saliva substitute sprays, and just make sure you are maintaining adequate hydration to keep that protective saliva flowing all day long. Ultimately, this all boils down to a message of profound optimism. As the experts at Akkineni Hospitals note, tooth decay is almost entirely preventable and highly treatable when caught early. The investment you make right now in proper brushing, using fluoride, and managing how often you eat sugar preserves your natural teeth for life. And having an expert partner like the comprehensive care team at Akkineni Hospitals ensures you have the exact risk assessment and restorative care you need every step of the way. So, as we wrap up this explainer, I want to leave you with one final thought to chew on. Pun absolutely intended. Think about your snacking and sipping habits today. How many times will your teeth face an acid attack, pushing that pH below 5.5? And are you giving them the proper tools to fight back? Keep that fluoride on your teeth, watch your sipping frequency, and stay curious. Thanks so much for learning with me today.